Can a country truly afford free healthcare for everyone? Health is not a luxury. It is a human need, and for many, it is a daily struggle. Around the world, people are asking the same question. Should healthcare be a right or a privilege? And deeper still, even if we all agree that everyone deserves access to healthcare, is it actually possible? Can a country really afford to offer healthcare to all its citizens without going bankrupt? These are not just political questions. They are deeply moral ones. Because behind every statistic is a real person. A mother needing surgery, a child in pain, an elderly father too afraid to go to the hospital because of the bill. So today, we're going to dive deep into this idea. Is free healthcare for all truly feasible within a country's budget? To begin answering that, we have to look at what free really means. Nothing is truly free. Someone always pays. In the case of healthcare, it's usually the government, funded by taxpayers. But here's the key. Just because something is taxpayer-funded doesn't mean it's wasteful or impossible. Many countries around the world, like Canada, the UK, Norway, and Sweden, already provide universal healthcare. These systems aren't perfect, but they prove that it is possible for a country to prioritize healthcare for all. However, the feasibility of free healthcare depends on many factors: the size of the population, the country's economy, the structure of its health system, and how efficiently the government allocates resources. But most importantly, it depends on values, on whether the country chooses to see healthcare as an investment or a burden. When we think about national budgets, we must consider how much is spent on defense, on infrastructure, on subsidies for corporations. And we have to ask, if we can find billions for weapons, can't we find billions for healing? One of the most common arguments against free healthcare is cost. Critics say it's too expensive, that it would raise taxes or lead to long wait times. But the truth is, many people are already paying more for private health care than they would under a universal system. In the US, for example, families often pay thousands each year in insurance premiums, co-pays, deductibles, and medication costs. Meanwhile, universal systems can negotiate prices, reduce overhead, and prevent medical bankruptcy. And we must not forget the hidden costs of not providing healthcare. When people can't afford to see a doctor, their conditions worsen, leading to more expensive treatments later. When children don't get basic care, their futures are affected, leading to lower productivity and lost potential. When families go into debt over medical bills, they spend less, invest less, and the whole economy suffers. So, by investing in healthcare, countries could actually save money in the long term. Of course, no system is perfect. There will always be challenges. Universal healthcare requires strict regulation, transparency, and constant evaluation. It also demands a cultural shift, where people accept that their taxes support the common good. But countries that have succeeded in implementing such systems show us that it is possible when there is political will and public support. Moreover, it's not just about economics, it's about humanity. Free healthcare reflects a society's compassion. It says, your life matters, no matter your income. It says, we are all connected, and when one person is sick, we are all affected. Because public health is not a private issue, it's a collective one. Pandemics taught us that. When the vulnerable are unprotected, everyone is at risk. And even beyond that, healthcare equality strengthens democracy. It builds trust in government. It unites rich and poor under one common service. It shows the world that a nation values not just profit but people, and that kind of message cannot be priced. So is it feasible? Financially, yes, if managed correctly. Socially, yes, if we are willing to care. Morally, absolutely. The real question is not whether we can afford it, but whether we choose to. In the end, the measure of a country's greatness is not just in its economy or its military power. but in how it treats its people, especially its most vulnerable. Free healthcare is not a dream, it is a decision. And like all meaningful decisions, it starts with empathy, with courage, and with the belief that everyone, regardless of their background or bank account, deserves to live with dignity, health, and hope.